Okay, since most of the people depressed in Kenya are concealed, there are no clear records on the exact number affected. However, the World Health Organization has ranked Kenya 6th with the highest number of depression cases among African countries. The latest statistics by the WHO indicate that a total of 1.9 million depression cases were reported in Kenya by last year. Now, we're seeing a new trend among the youth, especially among school children who commit suicide, mostly because of failing exams, as well as young jobless adults and those in relational crisis. May is Mental Health Awareness Month, and our topic of discussion tonight is depression. A lot of your questions have been coming in, a lot of your comments coming in on this issue as well. Let's begin by the fact that last week on social media, a tweet was sent out detailing how a young man died after sinking into depression over unemployment. And as you can see on your screens here, this conversation started with Marie here saying that unemployment is causing so many people to drown themselves in liquor and depression. That's ruining so many lives. And here she was talking about if someone knows a vacancy somewhere, a job opening, not to be selfish and help out as much as you can. And the response, as you'll see in the next tweet, was from this gentleman, Kevin Otienda, who said, "My brother finished his studies at JKUAT in 2004. He had a fee balance of 300,000. Every year he would watch on TV as others graduated. No one could employ him without papers. He started hallucinating and sank into acute depression and died in July of 2009. So let's begin by setting the stage with some information on this mental health condition. Remember, we're zeroing in on depression, which is a mental health condition. And as you can see, it occurs more in women than men. It may begin at any age, but its onset is higher in early adolescence to mid-20s, and it's more frequent among people aged between 18 to 29. And some of the features, or some of the things we should look out for: mood changes, decreased interest in previously pleasurable activities, fatigue, feelings of guilt, indecisiveness or decreased concentration, somebody just being spaced out. Also a significant change in appetite and weight. You could put on weight or lose weight. Changes in sleep patterns, changes in activity. You could, either be agitated or have decreased activity, and recurrent suicidal thoughts. So that is basically what we're looking at tonight. Once again, May being Mental Health Awareness Month, we urge you to send in your comments. Do you know someone? Do you suspect someone? Are you yourself depressed? Please share with us. Tonight in studio, I'm joined by Dr. Kendi Mbai. She's a psychiatrist at Mediva Wellness Center and Oasis Specialty Hospital. Thank you very much for joining us. And I'm also joined on this other end by Lois Tabaka, who is a project manager at an agribusiness and also was diagnosed as being depressed, has been diagnosed with depression. I'll start with you, Lois, and thank you very much for sharing your story. Let's begin with what triggered depression. What triggered this?
I think it started off some years back, but mostly I went through a traumatic incident sometime early last year, but then this depression ended up manifesting itself later on, like at about maybe 6 months later or something like that.
So you said you went through a traumatic experience. What were you feeling? How were you feeling? Something triggered this, you're saying. You went through trauma. How were you feeling? Explain to us what you were feeling.
You see, the first I didn't really know I was suffering through depression or something like that. Because after that, after the traumatic incident, I went back to work, I bounced back to work and everything. So I was just normal, I'd say, for some time. And then I started sinking into substance abuse. I was drinking. I noticed I was drinking more than usual. Then I have very close friends, about 2 close friends, who noticed something is really off with me, and they decided to. They asked me if I could start going for therapy.
Why did they notice that something was off? You were drinking, but was your drinking eliciting a certain reaction?
Yeah, it was eliciting a certain reaction, because sometimes I'd like zone out completely, and when I'm drinking, I could really drink like every day or something of sort. Yeah. So I came to notice maybe I was self-medicating with a drink, but sometimes I could like change my moods completely and start like acting like maybe I'm screaming, I'm wailing or something like that. But then most of the times when these things happen, I wasn't conscious enough for me to notice. So yeah, it was a very weird stage.
How old are you?
I'm in my late 20s.
In your late 20s.
Yeah.
Relationship-wise, at home and in terms of family, were people noticing the change within you? Yeah,
people were noticing because I think also I live alone, but also I was living with my brother because I was working outside Nairobi. So when I come to Nairobi, I was living with my bro. So they noticed something is off, like the family, like something is off with this chick. Maybe she's drinking too much and they were a bit concerned about it. Or I'm always like out partying or something. Or when I'm in my room, I'm just in my room. I don't want to get out of my room. I'm just like there for maybe a whole day. Or even a whole week. I don't feel like leaving my bed. I'd stay in the house, like especially in my room. The only thing that would make me get outside my room was peeing.
Yeah.
Yeah.
And we ran graphics there on some of the symptoms and some of the features of depression. Do you identify any of them? Are you familiar with any of those feelings?
Yeah, I'm totally familiar. I can totally relate to most of the symptoms. I could say like the time I was suffering through my depression, like the worst, I had lost a lot of weight. I was weighing like about 40-something kgs, which is so unlike me. So I had lost a lot of weight because I didn't have appetite completely. I never used to eat. I could go even like about 3 days without eating, which was very weird because I love food, like especially good food. But yeah, in fact, even my bro noticed something is off. This girl never really eats. Because yeah, sometimes you put food on the table, I take like 2 spoons and I'm like, no, I don't feel like eating. And besides that, also insomnia. Like my insomnia is still very bad, but I'm still treating it right now. So I never used to sleep. That's also another thing that made them notice something is off with me. So I never used to sleep. I could go even like 2-3 days without sleeping.
Right.
Yeah.
Lois, thanks for sharing that. So eventually, clearly you had to seek help. Was this by your own effort? Did somebody take you to seek this help? Take us through your journey in as far as seeking help and what happened after.
First, I'm really grateful to my very 2 friends because they noticed something was off with me and I didn't notice. Then they started paying for my therapy because I was still in denial, like I don't think something is wrong with me or something like that. So they introduced me to this therapist, like she's a psychologist. So she took me through some stages in my life and started counseling me on phone because I never used to live in Nairobi. So she went through, like, I think on the 4th session we had, I think if it's not the 4th, it's the 5th. She told me, Louise, I think whatever you're going through, it's psychiatric. So I'd really want you to come to Nairobi so that you can have some doctor diagnose you. So I came to Nairobi for diagnosis. And all this time, nobody knew because I was living alone in another town. So I came for the diagnosis, and when I went there, the doctor told me that I have clinical depression. I know in most cases, like enough people have said, I'm so depressed, you know. But even me, it was not so new to me. Yeah, I'd heard about depression before, but I was like, I can't believe this is happening to me. So when I went to the doctor, yeah, the doctor was like, you're clinically depressed, and have you been feeling like this, like that, and stuff. So I started taking medication without anyone knowing. So it was just like, I'm taking medication, but I'm hiding whatever I'm feeling. But the first week when I got there, the doctor said, like, if you need me to write you a letter to stay home, just let me know. I was like, just write me a letter, it's cool. So for that whole week, I stayed in the house. I was just sleeping. So I'm sleeping, I'm so lazy, I'm so tired.
The medication,
yeah, the medication
had that side effect.
Yeah, but then they start kicking in like after a week. So after like about 2 weeks, I was well. I went back to work, but then I noticed I started like, I was saying like, yeah, putting on weight. I started putting on weight more than normal. I was eating, my appetite was back. So Then after a while, I noticed my leg was swelling. My legs were swelling up. My shoes couldn't really fit, and I was having this pain on the knee. So my therapist advised me to come back to see the doctor after like 2 reviews or so. So when I came back, I found the doctor had gone on leave. So I was like, okay, now what do we do? So the therapist told me, it's fine, maybe you could stop the medication because it's making you feel so groggy and you're swelling up and your legs. So I don't know if that is the wrong thing or the right thing.
Just going back to treatment, because you're saying your doctor asked you to stop for a while. They did not prescribe something different for you?
I started experiencing anxiety also. Like I started experiencing anxiety because I was told by my therapist it's mostly because of the traumatic incident I went through. But also it comes also with depression. So sometimes I'd really lose my breath and have like struggles with breathing, and my heart was racing, like beating so fast and stuff like that. So I was also put on anxiety meds and antidepressants.
So this medication, anytime you would stop it, would the feelings that you were experiencing before recur?
Yeah, actually, at some point when I stopped, the worst thing is that I've noticed like mental illnesses have like a high affinity of substance abuse. So when I stop, I'm like, yay, holiday. It was like in December. So I'm like, yeah, finally I can have my drink again. So these medications, they don't go very well with alcohol. So I was like, yeah, finally, this is December, let me drink. So I did a very wrong thing to actually mix up my drugs with my whatever, with my medication. So by the time my doctor was coming back, I was put on antidepressants again and anxiety meds. But then after that, yeah, I mean, it was like I really needed to go through therapy again so that I can stop my substance abuse.
Right.
Yeah.
Thanks for sharing that. We'll come back to you. Dr. Kendi, looking at Louise here, she just looks like any other normal young adult. Yes. But her story is quite interesting in the sense that from face value, you can't quite read who is depressed, who is not. So what type of patients do you get the most common cases? I know we gave a rundown on age brackets, but in terms of the type of patients you get, what clusters are we looking at? What are we looking at in terms of types?
So thank you, Lillian. I thank you for this opportunity to be here today discussing depression. So the type of patients we get, they cut across all classes, from the young, from the wealthy, high class, from the poor, we might say poor. So mental illness per se doesn't have specific people that it affects, but it depends with which illness, but it cuts across all classes.
Why is it that according to the World Health Organization, women are said to be more prone to depression?
So for women, it's because of the hormonal changes and even things like childbirth. They go through a lot of stress. And then women, most of the time, they are prone to abuse. And at times also there is bias when it comes to diagnosis. So women are seen as the vulnerable group more than the men.
And something that she talked about here is the fact that she experienced trauma at some point in her life. So some of the triggers, and not just for women, but for men as well.
Yes.
Depression is actually triggered by something, because there are people who seem to have it all going on in their lives. They seem to have successful lives, perfect job, perfect neighborhood. I mean, perfect life, really, quote unquote.
Yes.
But still end up getting diagnosed with depression.
Yes.
So what are the triggers?
So some of the triggers, if I might mention, could be loss of a job. In case you are in a well-paying job, then you lose the job all of a sudden. That one is one cause. Then the other cause is traumatic stress. It could be maybe loss of a close relative, cases of rape, like women. And then the other one, I would say triggers would also be like for the youth, substance abuse. And through that, they go through a lot of depression because of that. Then I think the other thing is also unemployment. Yeah.
Yeah. And in terms of some of the things to look out for, how do you know someone is depressed? And I'm zeroing in on adults.
Yes.
What are some of the things to look out for?
So number one, what we look out for is when we are diagnosing depression, is that state of low mood that you're depressed most of the time. But it's more than sadness per se, because it's there most of the time, most of the day. Then these are the people who lose interest in activities they used to enjoy. Like, for example, somebody used to enjoy swimming, they used to enjoy going out with friends. Then all of a sudden, this person starts getting withdrawn. Then also, these are the people who have changes in their sleep. Either they can sleep too much or they might not be having enough sleep, which we say it's insomnia. Then other times, these are people who are suicidal. There are people who come to you and they say, there's no meaning with life and I want to end my life. Yes.
In children, because the statistics we ran there also indicated that children, particularly teenagers, can also be depressed or be diagnosed with depression. What should a parent look out for?
So I've seen this mostly in our Kenyatta clinic, where we run our adolescent clinic. So these are children maybe in secondary school who just become stubborn. There are people who are just irritable. They become angry over nothing. Maybe in class they don't want to read. They have problems with the teachers. Also, there are cases of students who run away just from school. They escape. Also, others, they are involved in those other activities that are not so pleasurable in school. So the teachers come to us, and most of the time we diagnose them with depression or other mental illnesses.
Right, and I'm going to direct this question to both of you. Alois, to you, the perception that people who are depressed are either crazy, possessed, people might just say you're unfriendly or you're a diva or you have an attitude. These negative labels, did you ever experience any of this while you were going through what it is that you were feeling? Why you labeled? Did people have an opinion? Did people perhaps just think that you were an attention seeker?
Yeah, I'd say it's very hard for people to understand at first what you're going through. First, I'd say there's the label for laziness. Just think you're lazy, or you're just there, you're so tired, you're fatigued all the time. Then also another stigma that comes with it is that, can you snap out of it? I mean, it's not like malaria or any physical illness. You take in drugs and tomorrow you're going to be fine. So someone asks you like, okay, you're taking drugs, when will you be okay? Sometimes when you tell someone this is a mental illness, they look at you like, are you serious? You're just seeking attention. There's some people, there's also stigma that comes with religion. It's either you're possessed or something, you should chase that demon away, you know, something like that. I can remember enough instances that I was suicidal. When some few people found out I was very suicidal, everyone was like, you should pray that demon away, whatever that's getting to you. You know, those thoughts of suicide are just coming from the devil or stuff like that. So it's very hard for you, because I got close to some other people who I could open up to. So it's very, the stigma is outside there. In fact, when you just say mental illness, people look at you like, wait, something is wrong.
Yeah. And that's true, Dr. Kendi. When you say mental illness, people just automatically label you as psycho.
Yes.
And, you know, particularly for parents, you know, whose first recourse, especially the spiritual parents, is to take their children to pastors. And we're not belittling spirituality and the role that it plays, but really just looking at this issue as more of an issue to hide from the public, that this is our family issue. We have this child who's the black sheep, or we have this child who just really went astray. What causes this, and how can we put an end to it?
So to understand you're asking about the causes for depression?
No, the causes around the stigma.
Around the stigma.
Yes.
So the causes for this stigma, if I may say, is I think our culture, how people have been brought up, and the way people have come to know mental illness and understand mentally ill patients. They are labeled mad, they are labeled crazy. So I think it's just our understanding and the way things are changing like today. Recently I had a patient from Eldoret. and she was diagnosed with the mental illness like 9 years ago. But because the husband didn't understand her, the husband said, "You are mad. I cannot stay with a mad woman." So you see how people can easily destabilize people's lives because of just, I'm diagnosed today with a mental illness, so it's like the end of my life. I would say it's not the end of your life. And I would say that it's better people to come out and talk about it instead of you whining and going down. I thank God because Louis was able to come and talk about it, but most people are not willing to talk about it. Yeah.
Which brings me to my next question. For a parent who's perhaps dealing with a young adult like her, who has literally given up on this child and said, no matter what I do, this child will never change. This child is out drinking with a wrong crowd. I mean, a child who is continuously just bringing shame to the family, quote unquote, a child who has refused to change their ways. Speak to this parent to understand that there might perhaps be an underlying issue, because we know a lot of parents who've given up on their children who say, the day you're ready to change, then come and talk to us. But a lot of parents have literally just given up on their children.
Yes.
Yeah. Speak to that parent.
Yeah. So I would say to the parents out there, let us handle our adolescents in the proper way, not by just beating or just putting them off. I would say listen to them, because this is the thing that I've seen in most of the cases. Parents are not willing to listen to their children, even when their children are trying by all means to speak out. But parents, we are busy with our jobs, we are busy with other things, and we forget that these children need us emotionally and even financially. Per se.
If depression is not treated, what happens?
So if depression is not treated, most of the time it can lead to death because of the cases of suicide that we are seeing. Yeah, that's the way most of the time it happens like that. Other times it might complicate to other illnesses.
It might lead to something else.
Yeah, to something else, altogether.
Okay, and as we give you details on where you can seek help if you think you might be depressed, or if you know someone who might be depressed, let's take your feedback on this issue. Remember, May is Mental Health Awareness Month, and we're talking depression, which is a mental health condition. Fred, you're saying, I learned of depression a few months after I lost my mom. It's now 10 years, but for sure it's not easy. Every time I think of her, I get affected so much. I've lived with this for 10 years. Thanks for sharing, Fred. King Sam, you're saying, I went through depression last year because I couldn't raise enough for my fee and don't feel entitled to anything. Sir Johnny, I'm actually recovering from depression. I had suicidal thoughts until one of my friends noted unusual transformation of my way of life. I stopped enjoying watching football. Then I secluded myself from everyone. Walela's son, can depression that goes untreated, especially in childhood, affect someone's adulthood? Good question. Yeah, and to Walela, his question there, whether if untreated in childhood, it can progress into adulthood as well?
Yes. Yeah, it is true. I can attest to that. There's a patient I've been managing who had depression, but it was untreated throughout most of her childhood, but came to manifest clearly when she's already married, and we are now treating her. So I would say yes.
And the thing is, the last time you're here in studio with me, Dr. You told me that the NHIF card does not offer, will not be able to help a patient that's seeking psychiatric health services, or that's seeking your services, say in your different institutions or health facilities. And therefore, the perception that it's very expensive to seek psychiatric help. Please, let's talk about that very briefly as we close. Where can someone seek help, and whether it's affordable, and if not, how to go about it then?
Yeah. So I would say mental illness per se is expensive. The treatment and the whole care, it's quite expensive. But I've seen the trend these days, the insurances, they are really helping. So if you can go that way, I would advise that. Then for the NHIF, it covers a bit, like for example in Mathari, yeah, it covers. So I wouldn't, we wouldn't discredit it completely. Some of them, it's helping some patients.
But we're still going back to the issue of stigma and the fact that, quote unquote, some people just associate Mathari for mental, like total, like, you know, like I'm mad. I've been called a mad person, which is actually not the case, because there's a lot of mental health conditions that are dealt with at Mathari. So let's speak a little bit about Mathari and the fact that you can actually go there with your NHIF card and get some assistance.
I know Mathari, they offer services of NHIF, people who have NHIF. So if you go there and you fully paid up for NHIF, you can be admitted without paying anything. It's just for the lab work, I know, but and maybe the medication. So I would say the NHIF still doesn't cover the part of buying your medication, but at least if you're being admitted, it can help you.
And Rep, can people reach you or your colleagues, people who actually need help or feel that they need help?
Yeah, so you can reach us through Oasis Health Specialty Hospital, which is in Westlands, Kitsuru. It's an upcoming psychiatric hospital, and we are offering services ranging from psychiatric detox and everything. Also, there is a Mediva Wellness Center in Thika. So that's where you can be reached. And finally, to you, thank you very much for sharing your story. As we close, did you finally get better? Are you still under treatment? Where are you today in terms of treatment and how you're generally feeling about yourself?
Well, right now I'm back on my feet. It's it's never been easy. I was off work for like about 4 or 5 months. I mean, it's good that I had a very good mentor and people around me. My support system was really good, and it's very important. Like my family, my friends, some of my closest friends, But I normally say if I didn't have a job, I wouldn't have pulled through, because the meds are really expensive. But I'm still taking my meds just to balance me. But I'm very optimistic. At least right now I can sit and talk about it. I can do some little work in the house and stuff like that.
And we thank you so much for sharing your story and indeed for your positive attitude towards getting better. As you've had, Lucy is saying that the medication is expensive. Daktari here is also reiterating the fact that treatment is extremely expensive, and therefore a call to the government to look into mental health and indeed allocating funds or making this health services accessible to families and persons that might need serious intervention and immediate intervention. We were discussing depression. We've been trying to understand depression tonight, this being Mental Health Awareness Month. Thanks for watching. We're taking a very short break, but when we come back, we're taking your feedback on breastfeeding. Remember, we aired a story tonight on a mother who was denied the right to breastfeed her child at a city restaurant, and we're going to be taking your feedback and your thoughts on the fact that public places rarely accommodate nursing mothers or even have facilities for mothers to change their babies. We're back with your feedback. Don't go far.